Thank you. Thank you so much, Dr. Paul. I'm really privileged and honored today to talk to you about this important topic, and I hope that you interact with us. It's very important to interact because it's a very new subject. So I'm sure that you have like many questions and concerns. So please feel free to ask all your questions. I will start with a brief introduction about myself, even though Dr. Paul talked most of it. But as Dr. Paul said, I graduated from University of Pittsburgh. I had my master's and PhD, and my dissertation was around ICF and vestibular disorders and measurement. So three different areas. And the thesis title is Development and Validation of Vestibular Activities and Participation Measure, which was used actually and has been used in people with vestibular disorders. Regarding my work, I've been working in University of Jordan since 2011. I had many positions, starting from the head of the department until the vice dean of the school from 2018 until now. I was the president of the Jordanian Physical Therapy Society for 3 years before Corona. And I published several papers now. There are more than 40 publications, actually. Most of them are in vestibular rehabilitation and concussion. And I published chapters in textbooks and international books. One of them is here about neurootology, and the chapter here is about physical therapy for persons with vestibular disorders. I also published a chapter about balance and falls in older adults in the 3rd and 4th editions of the geriatric physical therapy book. I also had an award from the WCPT, or World Confederation for Physical Therapy, or now WP. This award is about my presentation in Geneva in 2019, and it's called the World Confederation for Physical Therapy Outstanding Platform Presentation Award by an early career researcher. I have membership in different societies around the world. As you can see, I am a member at the Barani Society. It's a very well-known society for vestibular rehabilitation. I'm also a member in the Jordanian Athletic Therapy Association and International Parkinson and the WCPT. I was a member at the scientific committee of the WCPT 2019, and I'm married and I have 2 children. So this is briefly about myself. I will start immediately talking about our topic today. So the title is about the role of vestibular rehabilitation after sports-related concussion. Since this area is a little bit not well recognized, so I will talk about it. Starting with the conflict of interest disclosure, I have no conflict of interest of any sort, as you can see in this slide. In this presentation, we will cover 3 areas. So upon completion of this presentation, I hope that you understand the complexity of overlapping impairment patterns after SRC, also identify vestibular disorders post-concussion, and I mean clinically. Hopefully, you will be able to identify these disorders and impairments that are related to vestibular disorders after we finish this presentation. Also, to recognize the role of vestibular rehabilitation after SRC, because it's very essential and important, and I will convince you at the end of this lecture. Let's start to give you, some information about the vestibular system. So the vestibular system, that it has 2 parts, the peripheral part and the central part. The peripheral part, actually, that is located in the inner ear, consists of 3 semicircular canals, as you can see, and an otolith organ, as you can see here. Okay, and as you can see, it is connected to the hearing organ, which is the cochlea. Also, the vestibular nerve and vestibular nuclei in the brainstem are all part of the peripheral vestibular system. All these structures actually give important information to the central nervous system, including angular velocity in 3 dimensions, linear acceleration, and gravity information. As you can see in this complex pattern, there are complex interactions between the vestibular system and different parts of the brain, the central nervous system, and also other parts. So as you can see here, from vestibular vestibular nuclei in the brainstem, there are many loops and connections with the thalamus and then the cerebral cortex. Also, the autonomic nervous system, specifically, we're talking about the parasympathetic, and with the cerebellum, of course. Third of the cerebellum is called vestibulocerebellar part. And from the cerebellum, of course, there are connections with the vestibular spinal reflex that we will talk about it in a minute. Also, it has many connections with the cervical proprioceptors. This is peripherally, and the other organs and reflexes that we will talk about. So let's talk about the output of vestibular system. Actually, it has two main reflexes. Of course, there are other reflexes, but we will talk about these two main reflexes. The first one is called the VOR, or vestibulo-ocular reflex. It's a very important reflex. It provides information about angular and linear motion of the head. So wherever is your head moving, this reflex is very important to give the brain information that your head is moving in this direction. Okay. Also, it helps in providing information about the spatial orientation of the body. So where is our body in the space? The second important reflex that is connected to the vestibular system is called the VSR, or vestibular spinal reflex. It innervates the extensor muscles of the body as a whole, actually, the paraspinal muscles and the extensor muscle of the limbs, which is very important in standing up. You know, when you stand, you use all your extensor muscles. So if there's any problem with the vestibular system, then your patient will feel fatigued, will feel tired, So this is because of this important reflex. Actually, it controls mainly the neck movement. So there are rich supply to the extensor muscles of the neck or the cervical region. That's why when you get a person or a patient with a vestibular disorder, usually they have stiff muscles in the neck. And they usually think that neck spasm is the cause of the dizziness that they have. But it's the opposite, okay? They have dizziness. They have problems with the vestibular system, so this reflex is impaired or it has wrong information. That's why these muscles become stiff. So that control neck movements, so that the position of the head can be maintained accurately and is correlated with eye movement, of course. So let's talk about vestibular symptoms. If you get a patient or an athlete after sports-related concussion, what are the vestibular symptoms? What are the symptoms that you can tell that this symptom may be related to vestibular disorder after concussion, not like any other problems? These are a list of the main, actually, symptoms and the frequent symptoms of vestibular disorders, and they are dizziness, like just feeling of, it's a very subjective term, actually, dizziness, but this this feeling of lightheadedness, you can tell. Vertigo is a little different. Vertigo is a spinning sensation, so the patient will feel that the surrounding is moving even though it is still. Okay, imbalance, of course, so they feel that they are imbalanced. They have some balance issues. Also, they might have some nausea and vomiting. Incoordination. So if you tell them to do something like, this test, you will see that they have some incoordinated movements. And finally, headache. Headache is one of the vestibular systems that we underestimate, or we don't consider the vestibular system as one of the reasons of getting headache. And we're specifically talking about migraine headache, okay? So after talking a little bit about the vestibular system, let's go back to concussion and then connect both of them together. So as you know, sports-related concussion was defined in 2017 consensus meeting as a traumatic brain injury induced by biomechanical forces. And when we talk about biomechanical forces, then we have to talk about the skull, the brain, and the CSF, the cerebrospinal fluid around the brain. So as you can see here, this is the base of the skull. And as you can see, there are many edges, right, on this picture. And the brain actually lobes sit on these edges, on these fossa. They call them fossa, and there are edges around them. So when there is this biomechanical forces of the body or the head, then these edges will affect the brain, and this will cause brain laceration, maybe compression, maybe tension, shearing, or combination of any of these things. And that's actually the basic of pathophysiology of concussion. And as you can see in the right picture here, these are the main areas that usually affected by concussion. Why? Because of the edges, as you can see in this picture. So mainly the front of the brain will get affected, since the mechanical forces will move the brain forward and backward and to other directions. Of course, also the back of the brain, and we're talking about cerebellum, will be affected, since cerebellum also sit on the posterior fossa. And let's talk also about the temporal area. So the temporal area here will be affected. And actually what we have here is the vestibular system. So the vestibular system, and we're talking about the peripheral vestibular system, might be affected, and actually in most cases is affected after a concussion, based on these anatomical and physiological facts. If we, move to the symptoms of concussion, based on the CDC, there are some clusters of symptoms after concussion. One cluster is about thinking and remembering, and physical and emotional and mood, and finally sleep disorders. If you take a look at the physical symptoms based on the CDC, most of these symptoms are related to vestibular system. So first of all, headache might be related to vestibular system, might be related to other causes of the brain, of course. Fuzzy and blurred vision, sometimes it is related to the vestibular system and nystagmus in the eye. Nausea and vomiting, we just said that nausea and vomiting are related to vestibular system, especially with its connection to the autonomic nervous system, parasympathetic part. Also, dizziness, okay, a big part of the vestibular disorder symptoms. Sensitivity to noise or light is also another symptom of vestibular system. Balance disorders, it might be related to vestibular, cerebellar, and of course other causes. Feeling tired and having no energy, fatigued simply. So most of these symptoms actually might be related to vestibular disorder. That's why it is important to identify these disorders. In 2017, actually, in general, not about athletes, but Akin and his colleagues actually talked about the vestibular symptoms after mild traumatic brain injury, or what is called concussion, and they concluded that dizziness, imbalance are very common results after mild traumatic brain injury. And the bad news here is that these symptoms might stay for 6 months or longer after getting the traumatic brain injury. So if not treated early on, then it might affect your patients, for a long time. Now let's move to a very interesting paper that was published in 2019 by a colleague. Actually, he's a Jordanian colleague, Bara Salahin. What he mentioned in this interesting paper, that there are 4 main impairments after concussion, and specifically here we're talking about concussion in athletes. And as you can see here, so the first one is called cervical musculoskeletal. So CM in the green circle here. So of course, cervical musculoskeletal problems are very prevalent after concussion. The second one is the exercise tolerance, or maybe you can say intolerance, okay? And the ET is in the orange circle here, and then the functional mobility problems, and the FM is in the purple circle, and finally the vestibulo-ocular disorders in the blue circle. And as you can see here, 4 main impairments that makes up 9 possible combinations. Okay, so this is the complexity of disorders after concussion, because you will not see 2 athletes with the same symptoms after concussion. even though maybe the intensity and maybe the size, you cannot control all of these variables, but even though you could control some of these variables, each athlete will present with different combination, as you can see. So 9 combination of impairments after concussion, after sports related concussion. 6 of them actually include vestibular-ocular symptoms. 6 out of 9. So you can imagine how vestibular disorders are common and frequent after sports-related concussion. Actually, in another study also, they found that more than 90% of children had at least one abnormal findings in the vestibular system. And these are some of the tests actually and examinations that we perform after sports-related concussion to identify any vestibular disorder. So children with dizziness after sports-related concussion are very prevalent. More than 90% of them had abnormal finding in dynamic visual acuity test, sensory organization test, and rotational test. And they usually have problems with semicircular canals more than the otolith organ. Another study, also a very recent one actually, it is in 2021. So in this year, they found that so they had 2 groups of athletes after concussion, and what they found actually, they examined these all athletes. Okay, they classified them into 2 groups. One group with moderate to severe dizziness within 14 days of sports-related concussion, and the other group had no dizziness or just mild dizziness. Their findings actually are very, important. They found that the group with moderate and severe dizziness had worse sports-related concussion symptom severity. As you know, the 22 symptoms that we usually examine, these symptoms had more severity levels than the other group. Also, they had worse anxiety and depression. So now we're talking about psychological disorders, and they also had worse gait deficits than those with no or mild dizziness. So the presence of dizziness after sports-related concussion might deteriorate your athlete's case. So their rehabilitation process will be totally different. Okay, I don't know if we have time to see this video, okay, but I will try to make it shorter. So I just need you, okay, it doesn't work. Well, this video about a Jordanian athlete who played actually in Kuwait, and while he was playing there, he got a hit at his head, and the main symptoms, he like from the video, you can see that he had some dizziness and imbalance. Okay, that's what I wanted you to see. Let's talk about the management of sports-related concussion. According to the American Physical Therapy Association, they actually published guidelines for SRC in 2020, and they listed all these things that have to be managed after SRC, after sports-related concussion. Of course, the education part is important. Cervical musculoskeletal intervention is very important, and we will talk about them. And our topic and our concern today is talking about vestibular oculomotor intervention. So vestibular intervention is part of your management plan to your athlete after sports-related concussion. It's not an optional thing. It's a must according to these guidelines. Of course, there are other things that you have to do with your athlete. But let's focus on the vestibular ocular management. And here also, based on the guidelines, actually, they said it very clearly. Evidence indicates that physical therapy early after concussion is safe. Okay, so whoever thinks that maybe the intervention of a physical therapist is not that safe for athletes after sports-related concussion, this is a very strong evidence saying that it is safe, and we're talking about the first week of injury. Okay, the other very important information actually that they have mentioned in this article, that the combination of cervical and vestibular intervention was around 4 times more likely to get your athletes medically cleared for return to play, okay, by 8 weeks. Can you imagine? So if you just, there are a list of things that you can do with your patient here. But if you focus on these two things, cervical musculoskeletal intervention and vestibulo-ocular intervention, then you get your athlete back to play by 8 weeks, compared to other athletes who didn't get this combination of cervical and musculoskeletal intervention. Okay, and this is 4 times. So between between 4 athletes, then it's a very higher rate that you will get your athlete back to play if you do these two things. Okay, so let's focus now on the vestibulo-ocular intervention. What can you do if you find that your athlete has some vestibular symptoms? Okay, first of all, the physical therapist that will deal with your athlete in terms of vestibular rehabilitation should be experts. Okay, should have some training in vestibular rehabilitation because it's not an easy thing. Okay, so the physical therapist with appropriate expertise in vestibular and oculomotor rehabilitation, he is or she is the a person who can offer the intervention for athletes who need it. Okay, so what are these interventions? It might be canalis repositioning maneuver for benign paroxysmal positional vertigo. Well, this slide needs maybe another workshop to talk about these disorders. So sometimes your athlete from the head, especially if it is directly on their head, okay, they might have a disorder which is called BPPV, benign paroxysmal positional vertigo. There are some crystals inside the otolith organ. Usually they are detached. They detach from their place and they go to the semicircular canals and start flowing with the liquid there. Okay, with the endolymph. It's called endolymph. This needs a canalis repositioning maneuver. It's very simple. It's very easy. It's very effective. 90% of patients in general, okay, get better after the first session. So from one session, you can get your patient better and to get rid of this vertigo symptoms that they have, if they have it after sports-related concussion. Another procedure in vestibular rehabilitation that you can use is individualized vestibular and oculomotor rehabilitation plan. And I will show you a video, hopefully it will work, okay, about what we do usually with our patients to improve their vestibulo-ocular reflex and vestibulospinal reflex. Of course, individualized visual motion habituation is very important, and visual vertigo, visual motion sensitivity. So we work on these disorders and impairments to improve them through vestibular rehabilitation, and it is usually individualized. So it's not one recipe for all patients, okay? So you will assess your patients, and based on the assessment, you individualize or customize a plan of treatment for them. Of course, you will work on the motor part, okay, and intervention for your patients. And here we're talking about the VSR, vestibulospinal reflex, which is responsible for the balance of the patients. So you will work on the static balance for them, dynamic balance, motor coordination and control. Of course, dual and multitasking is very important for them because they're usually distracted. They cannot, easily perform these tasks. Also, you need some interventions that directly help improving motor function for work. So maybe your athlete is working also. So there are some specific interventions for work, recreation, or of course, sports-related activity. So these are some of evidence-based interventions, and we're talking about vestibular rehabilitation. As you can see in the left side picture here, this is the canalis repositioning maneuver for benign paroxysmal positional vertigo. This is the test actually. So it needs an expert actually to do it because we usually let the patient have in a long sitting position, and then we will turn, to a supine position with their head outside the bed. Okay, and in this position actually we observe their eyes, and they usually have nystagmus in certain directions, and according to the direction we diagnose the patient, and afterward we treat them based on this diagnosis. Okay, another intervention that is very important is the VOR movements, and let me explain to you one of the VOR. It's called VOR ×1. And in this exercise, actually, we ask the patient or the athlete to focus on one spot. So I will focus on the camera right now. And we ask the patient to move their head slightly but quickly to the right and left. Okay? So focus your eye and move your head 20-degree to the right, 20-degree to the left. Okay? And as much as you can, actually, we should move it to the right and to the left in 1 second. We call it 2 hairs. Okay? So this is one of the exercises. It's called VOR times 1, which is very helpful actually to patients. So your athlete in the beginning will not be able to focus their eyes. Okay? So whenever they move their head, for example, to the right, then their eyes will go with the head. Then you will ask them, no, go back and focus on this stationary maybe sticker that you put on the wall, for example, and ask them again to move their head. We have 3 semicircular canals, so you're targeting one of them. The second one will be up and down. Okay, you will ask your patient to focus on this stationary item and move their head also 20-degree to the above and 20-degree below, and make it in 1 second. So this is the second one. These 2 exercises are called VOR times 1. Okay, so just an example of the exercises that we give our athletes and patients post sports-related concussion, and they get better after them. In the beginning, of course, it will be, especially if you start with your patient early after sports-related concussion, it will cause, more dizziness to them. They might have some nausea feelings, maybe they vomit, all of these things, but you have to try and try until they get better. Also, other exercises in vestibular rehabilitation target balance. And in balance, of course, you start here in the middle picture, reducing the base of support. So you start with their feet comfortably, away from each other. But then you will go to B, which is Romberg standing, so feet together. Then you can do modified tandem standing, so one foot in front of the other, but not immediately, not closely, but to the side. And of course, your target to reach D, picture D here, which is full tandem standing, one foot in front of the other. Of course, you will use other foam, which is very important actually for balance exercises. And this is actually the recommended one by the USA. It's called IREX, okay? And of course, you will do some sit to stand. It's very important for core muscles, and some of them will get dizzy just standing and sitting. It's called chair sit to stand exercises. Okay, so these are some examples actually of vestibular rehabilitation exercises that you can use with your athletes after sports-related concussion if you find any vestibular symptoms with them. I'm sure that all of you know the VOMS. It's called vestibular ocular motor screening. This is actually one of the assessment tools that we use with athletes after getting a concussion, and they actually work on the most frequent symptoms with them. So in this, let me see. In this test, actually, it was created by University of Pittsburgh. So in VOMS, first of all, you ask about 4 symptoms. You ask about headache, then dizziness, nausea, and fogginess. Okay, in headache, and in each of these symptoms, actually, you ask them to rate this symptom from 1 to 10. 1, there is no symptom, there's no feelings of this symptom, and 10 is severe. For example, headache, severe dizziness, severe nausea, severe fogginess. At baseline, without doing any movement, you start with taking all these scores out of these 4 symptoms. You write them here. Okay, you write any comment before that. For example, they have some headache because they already usually, for example, they already had a migraine headache before even getting the sports-related concussion, for example. So you write any comment here just to make sure that you understand your athlete. Then you start with the first exercise. Actually, all of these tests, these are tests, but you can use them as exercises afterward. The first one is called the smooth pursuit. It's a very nice and important test and exercise for your patient. In smooth pursuit, simply you ask the patient to keep their head still and follow a moving target by their eyes. And I hope you can see me. I will try. So can you see the pen? We can ask them, for example, okay, to keep their head still, as you can see, my head, and then just follow with my eyes. So I'm moving the pen horizontally and I'm following the pen by my eyes without moving my head, okay? So we will do it horizontally and then we will do it vertically. Again, so as you can see, we will have the pen and then move it vertically, and I will keep my head still and just moving my eyes following this moving target. This is called smooth pursuit. Okay. Of course, there are some instructions. Okay, so they have to be 3 feet away, okay, from the moving target. For example, we have to move also 3 feet between, horizontally and vertically. The second one is called saccades, and it is horizontal. For this one, actually, also we hold two targets, as you can see, and we'll ask them again to keep their head still and just move their eyes between these two targets. If you can see them, okay, these two pins, okay, so they will start moving their eyes between these two targets. Our mission here, our goal is to focus on their eyes. So you, as a physical therapist or a healthcare professional, you will focus on their eyes and see if there is a saccade. And saccade is moving after the target and then going back, or not reaching the target and then make this, movement. It's in coordination. We usually talk about in coordination in big muscles. So we talk about, for example, finger to nose. This is in coordination. But the eyes movement are coordinated for us as normal people. In these patients or after any insult, just like sports-related concussion, the coordination of the eye is affected, just like the coordination of the upper extremity or lower extremity. So we have to assess that and start also improving that. Think about your athlete when getting, for example, a ball from whatever side it's coming, and their eyes are not coordinated well, then they will not see the ball in the right way. Okay, so you have to work on the saccades in the horizontal direction and in the vertical direction. So in vertical direction, you will hold two pins, as you can see here, and we will ask them again to keep their head still and move their eyes between these targets, but it will be vertical movement, as you can see. Okay, so this is saccade horizontal and saccade vertical. The fourth one, actually, it's called convergence. In convergence, you have to have a tongue depressor, and you will have an X with I think a 12 font on it, okay, and you will ask the patient to hold it in front of him or her, and then make it closer to their nose, and stop when they see double vision. When they see the target like like double vision. And then we will take the measurement between the nose and this target. And of course, there is a normal range and there is abnormal range. So this is convergence. Let's talk about VOR, horizontal and vertical, and that's what I did with you, actually, which is focus on one target and move your head horizontally, as you can see. So here your head is moving and your eyes are stationary. Okay, stationary. So your eyes are stationary on the target and you're moving your head horizontally and vertically. Okay, the final one, I hope I can show it to you with the camera. Okay, it's called visual motion sensitivity. It's a very difficult one, actually. So the patient should be standing, okay, and holding. They can use their thumbnail, okay, as you can see. I hope you can see it like this, okay, and then they will move their torso 180 degree, okay. So they will keep looking at their nail, okay, at their thumbnail, and they will move their whole arm and torso 180 degree. Of course, after each test, we should re-ask the patient about scoring these 4 symptoms. So we can ask them again, rate your headache, rate your dizziness, rate your nausea, rate your fogginess, and of course write all of these numbers to see which one of these exercises are exacerbating their symptoms. Okay, so this is a very important assessment tool after sports-related concussion regarding or concerning vestibular disorder, and you can use the same tests actually as an exercises for treating them. Okay, so this is also a nice actually paper that was published in 2020, and they said that changes in VOMs in adolescents treated with vestibular physical therapy after concussion are very effective. So they had the individualized or customized vestibular rehabilitation in clinic, and at the same time they gave them VOMs at home, okay, to do them. And as you can see here, this table is from the paper. So they found that, you know, all of these exercises, smooth pursuit, horizontal saccades, vertical saccades, convergence, also horizontal VOR and vertical VOR, as well as visual motion sensitivity, with all of these exercises and the progression of the exercise. That's the nice thing. So you can see here for each exercise that, you know, the let's say the beginning of exercise, and then the progression of this exercise, because we usually go, you know, harder with our patients to make sure that they are getting better. Okay, so this is a very nice paper also to take a look at, and you can see that VOMs are very effective actually in improving these symptoms. This is also regarding the visual habituation. This is a project that we are conducting now with the U.S. Army Medical Research materials. Also, it doesn't work. I don't know why. Let's see if it works. Okay, great. So you will see some of our exercises with our patients. The nice thing here that we are trying to use an application to make sure. Can you hear it? Can you hear? I don't think that you heard anything, right? From the video.
No, we can't hear it, but it's okay. You can show the video and talk through it.
Ah, okay. No. I can. There's something that we can do and hear it, because it is in English. Here. Yes. Here we go. So now I will share and you will hear what it says.
Motion intolerance, and other symptoms consistent with peripheral or central vestibular pathology. Home exercise programs are an integral part of vestibular rehabilitation to promote symptom improvement in patients. A major component of these exercises is the adaptation of the vestibulo-ocular reflex and habituation training. Presently, there is no way to track if patients do the home exercise program or if they do the exercises correctly. In partnership with the U.S. Army Medical Research Program and Material Command, Intelligent Automation Inc. has developed Vestaid, a mobile application designed to provide feedback to the physical therapist and patient about their performance. Used at home or in the clinic, physical therapists can easily adapt the exercise program to meet the needs of the patient. Short video files teach patients how to perform their exercises. These movies can be reviewed at any time to help patients who are having difficulty performing their prescription. Using head and eye motion capture, the physical therapist is provided with precise information about the patient's gaze targeting, head speed compliance, and a recording of their performance. Before and after the exercise, the patient provides symptom ratings to help gauge exercise changes. A gamified reward system has been developed to incentivize patients to adhere to their prescription and improve exercise compliance. For more information about Vestaid, contact Dr. Susan Whitney or Dr. Brooke.
So this is like an example about how we deal with our patients, and as you heard, it's still a research that we are trying actually to see if this application would work with our patients in order to make sure that they, about their compliance of the exercises, especially at home, because home exercises for any person who has some vestibular disorders are very important. So again, we tell our physical therapists that you need to refer your athlete if needed. So you should refer your patient or athlete for further consultation, especially if they have persistent migraine, typical chronic headache. And what we mean by persistent is longer than the normal period of any, disorder or impairment. Also, any vision impairments, including ocular alignment. Okay, so not nystagmus. Nystagmus is a usual impairment that we get and we see with vestibular patients, but like ocular alignment is very important. Also, any auditory impairment that may get sleep disturbances, they need some sleep hygiene intervention. Also, any mental health symptoms, just like anxiety and depression, that is also persistent and not relieving. Also, any cognitive problems that are not getting better. Of course, athlete education is very important. So you have to educate them about their case. You have to tell them that, your head had this trauma, you might have this problem or that problem. It's not like, one way or another. It's a complex way of treating you. So you have, to try several things. And of course, again, I'm really like concentrating on the musculoskeletal and cervical musculoskeletal intervention combined with the cervical intervention, which proved to have a very, important results regarding return to play. And these are the references, and thank you.